Okay, so you're probably familiar with this scene. You're relaxing, and suddenly your dog starts dragging its butt across your favorite rug. That classic scoot.
Yeah, the scoot. Or maybe you've noticed that. Well, that really strong kind of fishy smell.
Exactly, that smell. It's unmistakable. Well, these are often signs of something pretty common, but maybe not totally understood. Canine anal sacculitis. So today we're doing a deep dive. We're looking at what these glands are, what goes wrong, the surprising causes sometimes, how you can help prevent it, and the treatments available.
Right.
Our goal here is really to give you a shortcut to understanding this because it can be really uncomfortable for our dogs.
It definitely can. And yeah, it might seem a bit squeamish to talk about, but knowing this stuff is so important for your dog's comfort, for their health.
Absolutely.
And what's really interesting, I think, is just how many different things can feed into this problem and why catching those signs early is key.
Okay, let's unpack it then. Anal sacculitis. First things first, what are these anal sacs? Where are they? And what's their normal job supposed to be?
Okay, so the anal sacs, people often call them anal glands too. They're these two small sort of pouch-like things.
Sure.
You find one on each side of the anus. Think like 4 o'clock and 8 o'clock positions on a clock face.
Gotcha.
And inside, they produce this thick, oily, often pretty smelly fluid, really distinct odor.
The infamous odor.
That's the one. Normally, this stuff gets squeezed out naturally when a dog poops, just from the pressure.
Right.
And the main purpose, well, we think it's mostly about scent marking, like leaving a little "I was here" note for other dogs, their own unique scent signature.
Ah, okay, like a calling card.
Exactly. So anal sacculitis, that term means inflammation or infection or maybe both in one or both of those sacs. And yeah, it can cause real discomfort, even pain.
Okay, so if they're not working right, what are the signs? What should you as an owner be looking out for besides maybe the obvious discomfort?
Well, the symptoms can definitely range a bit depending on how bad it is. But yeah, the number one sign most people recognize is that scooting or sledging, dragging the rear end. You might also see your dog licking or biting back there a lot, like obsessively. And that smell we mentioned, a really strong, maybe fishy kind of odor from that area. That's another huge clue.
That fishy odor is definitely memorable. What else might you see?
It really is. Beyond that, look for signs of pain. Maybe they seem uncomfortable when they sit down or when they're trying to poop. That's called dyschezia.
Dyschezia?
Yeah.
Painful pooping.
Yeah. And they might strain a lot. That's tenesmus. Or even seem hesitant to go at all. You might notice constipation or just difficulty passing stool because it hurts or there's swelling.
Okay.
Visually, you could see swelling, redness, just general inflammation or tenderness right around the anus in the perineal area.
Some visible signs too.
Sometimes, yeah. And sometimes there's discharge. It might even look bloody. Or you might just find little spots of discharge where they've been sitting.
Oh, wow.
In really bad cases, you might even see things like fever, or they go off their food. And you can get abscesses forming.
Abscess.
Yeah, like a pocket of pus under the skin. Really painful. They can even burst open, creating these little tunnels called fistulas.
Yikes.
And one last thing. Sometimes dogs will just hold their tail down differently, or maybe wag it low and frequently, just because of the irritation back there.
That's quite a list. It sounds incredibly uncomfortable. So what actually causes this? Does it just happen, or are there usually underlying reasons? You mentioned it's often secondary.
That's a really important point. It's rarely just out of the blue. The most common immediate issue is that the sacs just aren't emptying properly.
Okay, a blockage, basically.
Yeah, impaction. The fluid gets thick, builds up, causes discomfort. And then because that stuff is just sitting there, it creates the perfect environment for bacteria to grow, leading to infection and inflammation. So impaction often comes first.
Got it. So what causes the impaction then? What stops them from emptying normally?
Several things can play a role here. Diet and stool quality are big ones.
Ah, diet again.
Always seems to come back to diet, doesn't it? Lack of fiber, maybe not enough fatty acids.
Or
if the stool's too hard, maybe from dehydration or not enough fiber, it doesn't provide the right pressure.
okay.
But interestingly, the opposite can also be a problem. Frequent bouts of diarrhea or really loose stools can irritate the area and lead to inflammation too. Sudden diet changes can also trigger issues.
So consistency is key then.
Pretty much. Obesity can be a factor too. Maybe poor muscle tone in heavier dogs affects emptying, though the research there is a bit mixed on a direct link.
Okay, here's something I've heard kicked around. Allergies. They seem linked to everything in dogs. Does that apply here too?
Oh, absolutely. And this is a huge one that often gets missed. Allergic skin disease is a really common underlying cause.
Really? How does that work?
Well, think about it. If a dog has allergies, maybe to food, maybe something in the environment, like pollen, causing atopic dermatitis, they often get inflammation around the skin, including the skin around the anus.
Ah, okay.
That inflammation can narrow the little ducts that the anal sac fluid comes out of. So duct gets narrow, fluid gets trapped, impaction, then maybe infection, sacculitis.
Wow.
Some studies even suggest allergic dogs can have an imbalance of the normal bacteria in the sacs called dysbiosis, making them more prone to issues.
Yeah.
So yeah, allergies are a major player, especially in recurring cases.
That's fascinating. So it's not just about the poop. Are certain breeds more likely to get this?
Yes, definitely seems to be a breed factor. Small breeds often seem predisposed to impaction and sacculitis. Chihuahuas pop up a lot.
Little dogs, big problems sometimes.
Sometimes. But interestingly, some studies show breeds like German Shepherds and Labs might also be overrepresented. And Spaniels and those brachycephalic breeds, the short-nosed ones like Pugs and Bulldogs, they seem prone to.
Okay. Any other factors?
Age can play a part. Older dogs might be more prone. Same for pregnant females. Sometimes fluid builds up. Anatomical issues, like if the ducts aren't formed quite right. Even things like generalized seborrhea, a skin condition, could cause glands to overproduce.
Seborrhea, okay.
And maybe even just inactivity. Less exercise might mean less natural squeezing action. And finally, if there's already an infection, that inflammation itself can block the duct, leading straight to an abscess.
It really sounds like a combination of things can contribute. So thinking about prevention, what can owners actually do to stop this from becoming a chronic headache?
Yeah, prevention is often about managing a few key areas. Good digestive health and stool consistency are really number one.
Right. Back to the poop.
Back to the poop. Making sure there's enough fiber is key. Things like ground flaxseed or even a bit of canned pumpkin can help create those nice, firm, bulky stools.
Why bulky?
Because that bulk provides the natural pressure needed to squeeze the sacs during defecation. It helps them empty like they're supposed to.
Makes sense. So diet is huge. What else helps prevent it?
Regular exercise is good. Helps stimulate things naturally. Keeping your dog at a healthy weight is important too, partly for that muscle tone aspect.
Okay.
And crucially, managing any underlying allergies. If your dog has known allergies, working with your vet to control that skin inflammation, especially around the rear end, can make a massive difference in preventing flare-ups.
So tackling the allergies is key for prevention too, not just treatment.
Absolutely. Some people explore natural things like quercetin. It's a plant flavonoid that might help reduce inflammation in the ducts. Regular vet checkups are also good. Your vet can check the sacs periodically and manually express them if needed.
What about groomers doing it?
Yeah, some groomers offer it routinely. But honestly, if the glands are emptying normally on their own, regular manual expression isn't usually necessary and could potentially cause irritation over time. Best left to when there's an actual problem or under vet guidance.
Good point.
And lastly, try to prevent your dog from constantly licking the area if it seems irritated. That licking can just make things worse.
Okay, that's a lot of great preventative advice. But what if, despite all that, your dog still develops anal sacculitis? What are the treatments and why is getting to the vet so important?
Yeah, sometimes it still happens. And prompt vet care is really essential. Please don't try to treat this yourself at home, especially not expressing impacted glands yourself. You could cause more harm, injury, or make an infection worse.
Right, so first step, vet visit. How do they diagnose it?
Usually through a physical exam. That often involves a digital rectal exam, carefully feeling the glands.
Which probably isn't comfortable for the dog.
Exactly. It can be quite painful, especially if they're inflamed. So sometimes sedation might be needed just to do a proper, thorough, and less stressful examination for the dog. Then the treatment really depends on what they find: impaction, infection, inflammation, maybe an abscess.
So what are the typical treatment steps a vet might take?
Okay, if the sacs are just impacted, blocked up, and not infected, the vet will gently manually express them to empty them out.
Squeezing them out.
Basically, yes. If the material inside is really thick or dry, They might infuse a little saline or a softening agent first to make it easier to express.
Okay. What if they are infected or inflamed?
Then, after expressing, they'll usually clean the area with an antiseptic, like chlorhexidine. Then they'll flush the inside of the sac itself, often repeatedly with saline, until all the debris is gone and the fluid coming out runs clear.
Flushing it out. That sounds like it might need sedation, too.
It often does, yeah. It ensures the dog is comfortable and allows the vet to be really thorough.
And then medications.
Often, yes. After flushing, vets frequently infuse a special solution directly into the sac. This usually contains a mix, maybe corticosteroids to reduce inflammation, antibiotics to fight infection, sometimes even antifungals.
Direct infusion.
Yeah, it's become a really common and effective approach. It targets the problem right at the source and can help reduce the need for systemic antibiotics, pills, or injections that go through the whole body. That's better for avoiding antibiotic resistance.
Good point. But sometimes systemic antibiotics are still needed.
For sure, especially if the infection seems more severe or widespread. Anti-inflammatory meds like pain relievers might also be prescribed to help with comfort.
What about things owners can do at home to help during treatment?
Warm compresses can be really soothing. Holding a warm, damp cloth gently against the area for, say, 15-20 minutes, maybe a couple of times a day, can help reduce discomfort and promote drainage, especially if there's an abscess trying to form.
Any special ingredients for the compress?
Some people use a simple mix of warm water, a bit of salt, maybe some aloe vera gel. Again, dietary adjustments like adding that supplemental fiber can help get things moving naturally again.
You mentioned trying not to treat at home, but are there any safe home remedies for just like super mild surface irritation, or is it always vet first?
That's a fair question.
Yeah.
For very mild, clearly superficial irritation, like just a little redness on the outside skin, no swelling, no scooting, no pain, some people might try a tiny dab of something like topical preparation H for soothing, or maybe propolis spray, which has natural antiseptic qualities.
Yeah.
Some use topical CBD for inflammation too.
Okay.
But, and this is that's only if you're absolutely sure it's just surface stuff. If there's any hint of impaction, infection, pain, scooting, anything more than the mildest surface issue, vet visit first is definitely the way to go. Don't guess.
Got it. Vet first for anything beyond super minor irritation. Now, what happens if these medical treatments just don't cut it? Like if it keeps coming back? Is surgery an option?
Yes, in chronic recurrent cases that just aren't responding well to medical management, or unfortunately if cancer is found in the sac, then surgery might be recommended. It's called an anal sacculectomy, removal of the sacs.
Removal, okay.
The preferred method is usually the closed technique, where they remove the sac whole without cutting into it first. It tends to have fewer complications.
Are there risks with the surgery?
Oh yes, definitely. It's delicate surgery near important nerves and muscles. Potential risks include things like fecal incontinence, difficulty controlling bowel movements if nerves are damaged. Sometimes fistulas can form if the removal isn't totally complete, or scar tissue can affect the sphincter muscle.
So it's not a minor procedure?
Not at all. It's generally reserved for those cases where medical therapy has failed, or for cancer. It's not usually a first-line treatment.
Any other advanced options?
Laser therapy is something that's shown some promise, especially for helping ruptured abscesses heal faster and with less pain. And definitely, during recovery from any treatment, especially surgery, expect the vet to recommend an Elizabethan collar.
Ah, the cone of shame.
The cone of shame. But it's crucial to stop the dog from licking or chewing at the area, which would just delay healing or cause new problems.
Wow, okay. This has been incredibly thorough. We've covered everything from what these glands even do to diet, allergies, genetics, prevention, and all the treatment layers.
Yeah, it's quite a journey for such small glands.
Absolutely. I think the biggest thing for the listener is realizing how much you can pick up just by watching your dog's behavior, recognizing those signs of discomfort, even the subtle ones.
Exactly. And if you zoom out, it really shows how interconnected a dog's health is, right? Diet, activity, allergies, they can all show up in places you might not expect, like the anal sacs.
That's a great point.
It kind of makes you wonder, doesn't it?
Yeah.
What other little quirks or behaviors does your own pet have that might actually be signaling something deeper about their health that maybe you haven't considered yet? Something to think about.